We need to look at the Ebola timeline to understand why we should have known for some time that it was coming. Before October, when Dr. Craig Spencer, the first New York Ebola patient, came home, went bowling, rode the subway, and ended up at Bellevue Hospital. Before September, when nurses Amber Vinson and Nina Pham got Ebola by treating Thomas Eric Duncan.
Thomas Eric Duncan died today in a Dallas hospital.
Before Duncan died from Ebola, and before the Texas hospital admitted mistakes in their treatment of Duncan.
We made mistakes, and we are deeply sorry.
Before August, when the first 2 Americans treated for Ebola arrived in the U.S. Even before the summer, when the deaths in West Africa in June were in the hundreds, not thousands. Before all this, we were warned about Ebola by Doctors Without Borders. They warned us 7 months ago with words.
On est confronté à la souche la plus agressive d'Ebola, la souche Zaïre. C'est une souche qui tue plus de 9 personnes sur 10. Il n'y a pas de traitement, donc on n'a pas un médicament qui tue spécifiquement le virus.
And pictures. Those pictures were perhaps the first we saw of the now familiar ritual of donning protective gear.
This outbreak of Ebola is like none ever seen in history.
Dr. Richard Besser is the chief health and medical editor at ABC News and former acting head of the CDC.
We were warned. Yeah. I mean, Doctors Without Borders, the end of March, said that this was an unprecedented outbreak, something the world had never seen before, but the world didn't respond. This organization has provided the clinical care for, I think, every Ebola outbreak that's ever taken place. They have more experience taking care of Ebola patients than any organization in the world.
Doctors Without Borders is a humanitarian group founded in France over 40 years ago. It is known internationally as Médecins Sans Frontières, or MSF. The author of a book about MSF said the outbreak in March was like nothing they had ever seen.
The previous outbreaks of Ebola that occurred in Africa, 20-some odd of them, had been easy to contain. This one, from the very outset, looked as if it was going to be wildly out of control.
Ever since March 31st, MSF has kept a steady drumbeat about Ebola. They gave us the stories from their workers.
Last week we came to a village where we had around 40 patients from one village. It's unbelievable. I never have seen it before.
All areas, all districts of the city today have people dying and people getting sick every day. There are too many and the response is too weak.
They also gave us their small victories.
There was one site in Guinea where we managed to reduce the death rate to 25%. And we managed to do that because the community were extremely receptive to the health messaging that we were giving them.
MSF has not only issued news releases and held news conferences, they have a strong culture of having their field workers blog about their experiences. But the smiling faces on the website are a sharp contrast to their words. Epidemiologist Catherine Stinson wrote, "Hospitals have been forced to shut due to healthcare provider deaths and desertions and lack of infrastructure. Ebola-stricken patients are turned away from the remaining hospitals due to no capacity to take in more." Patricia Carrick blogged, "The people are dying in ambulances on their way to us, quietly in corners of our treatment center, under the beds, sometimes crazily stumbling from place to place. The final stages of this disease must be agonizing." Finally, on September 3rd, Dr. Joanne Liu, international president of MSF, brought the organization's frustrations to the United Nations.
6 months into the worst Ebola epidemic in history, the world is losing the battle to contain it. Leaders are failing to come to grip with this transnational threat. Riots are breaking out. Isolation centers are overwhelmed. Health workers on the front lines are becoming infected and are dying in shocking numbers.
And she scolded the international community for ignoring the epidemic for months.
Médecins Sans Frontières has been ringing alarm bells for months, but the response has been too late, too little. It is your historic responsibility to act now.
Despite all this, today MSF faces criticism because many people don't understand how Dr. Craig Spencer could have come back to New York after treating Ebola patients and gone out in public.
And I don't understand why people, who have been exposed to Ebola don't just stay home.
Even a former MSF volunteer, Dr. Matthew Bank, a New York surgeon who worked for MSF in 2007, has some questions.
If it was me personally, I probably would wait out the 21 days somewhere, maybe not come home right away, but somewhere where I had very little interaction with everybody else.
But while the debate over protocols, travel bans, and quarantines goes on, MSF would likely remind the world of the fundamental reality of Ebola that is difficult for us to face.
To put out this fire, we must run into the burning building.